Welcome everyone, I'm Sue Newn from Pavo. Sionna Jones-Pritchard will be supporting the Welsh language in this session.
A dyn ni'n falch wrth gwrs eich bod chi wedi dod i'r gweithdy yma ar daclo unigrwydd ac arwahanrwydd cymdeithasol, rhywbeth sydd wedi dod i'r amlwg mwy fyth yn ystod y pandemig. Ac yn ystod y gweithdy, fyddwn ni'n edrych ar ddwy enghraifft o sut reith bod i'r afel ac unigrwydd mewn ardaloedd gwledig eraill.
We're pleased that you've come to this workshop about combating loneliness and social isolation, which has become an even bigger issue during the pandemic. We're delighted to have two examples of how loneliness has been tackled in other rural areas.
A mae gennym ni hefyd ragor o wybodaeth am gyllid Llywodraeth Cymru sy'n dod allan I awdurdodau lleol I ariannu prosiectau yn ei hardal. Ac yn ola, mi gawn ni gyfle I rwydweithio a rhannu syniadau efo sefydliadau eraill a fydd yn helpu sefydliadau trydydd sector I weithio ar gynigion prosiect ar y cyd wrth I gyllid dod ar gael.
We also have more information about the Welsh Government funding which is coming out to local authorities to fund projects within their area. Finally, there's an opportunity to network and share ideas with other organisations, which will help third sector organisations to work on joint project bids as funding becomes available.
A mi fydd y sesiwn yma'n cael ei recordio fel y gallwn ni sicrhau bod ar gael fel adnodd i'r sector wedyn. Mae'n anebygol y byddwch chi'n gallu cael eich gweld ar y recordiad, ond os oes unrhyw bryderon, trowch eich camera ffwrdd yn ystod y sesiwn. A fyddwn ni ddim yn recordio'r sesiynau trafod. Ac yn ola, os ydych chi'n trydar am y digwyddiad, defnyddiwch yr hashnod Pavo Conference 2021 a hashnod cynhadledd Pavo 2021. Ar ddiwedd y sesiwn, byddwn nhw'n gofyn cwestiwn mewn poll ac yn ddiolchgar os allwch chi ateb I roi adborth ar y sesiwn. Yna fydd na arolwg barn arwahan am wythnos cynhadledd Pafon cael ei anfon unwaith bydd yr holl ddigwyddiadau wedi gorffen. Wrth gwrs, mae'n ddefnyddiol iawn I ni gael adborth ar yr hyn aeth yn dde a'r hyn oedd ddim cystal i'n helpu ni gynllunio ar gyfer y flwyddyn nesaf. Diolch.
The session will be recorded so that we can make it available as a resource for the sector. It's unlikely that participants will be visible on the recording, but if you have any concerns, please turn off your camera during the session. We will not be recording the breakout sessions. If you're tweeting about the event, please use the hashtags that you can see on your screen. I'm delighted to welcome Peter McAndrew, who's arrived from the Orkney Islands, and we're going to be hearing a bit more about what they've been doing. So welcome to Peter, and shall we just go straight on with your presentation?
Thanks very much, Sue. Yeah, and thanks for the invite to come up and speak with you about the work going on up in Ork. So I've just got a bit of a presentation. I'll just share now and just talk through.
Hi there, thanks very much for having me along to the AGM virtually. If you're seeing this, I probably haven't been able to actually access the meeting because I'll be on a little island somewhere, so I've just recorded this in case. So this is the first time I've done one of these as well, so if you'll excuse me if it's a bit rough and ready, but I shall do my best. Not done deliberately, but actually have a prisoner thing from Portmeirion up there, so quite relevant. I didn't realise until I switched the camera on that it would be on there, so I usually blur that out, but I'll leave it there anyway. Okay, so just here to really speak a little bit about the use of digital technology and in health and well-being and in reducing isolation. So really it's the focus of this will be on that aspect of my project, which is around tackling social isolation using technology. So just to give you a little bit of background, so I'm Pete McAndrew, and my role is tech peer mentor within Voluntary Action Orkney. My background is as a social worker, so worked as a social worker in children and family social work for about 10 years before moving into this role about a year ago. So I work as, say, the Tech Peer Mentor, and that's a 18-month project that's funded through Tech Scotland. So that's the technology-enabled care main sort of Scottish government body that promotes the use of tech in Scotland. And the project is part of a wider programme of projects across Scotland, which is focused on taking a service design model approach to improving services. So our project in Orkney is linked with East Ayrshire, who are one of the lead project areas. As I say, the project sits within Voluntary Action Orkney, and that's the third sector interface in Orkney. Not sure if you have a similar kind of structure in Wales. So Voluntary Action Orkney really provides a kind of umbrella organisation providing support, guidance, some functions like payroll, accounts kind of functions to other charities and third sector organisations in Orkney. So they have core staff who carry out those functions, and then there are separate projects that sit within Voluntary Action Orkney. So one of those would be the Adult Befriending project. And there's an island wellbeing project as well, and the Tech Peer Mentor project is one of those as well. So just a little bit of context, really. So the geography. So it's the blue islands you can see at the top there. So that's where we are off the north coast of Scotland. About an hour and a half ferry trip from John O'Groats over to Orkney. Population round about 22,000, and the main island on Orkney is known as Mainland, and that's where the majority of the population live. And Kirkwall, our main population centre, the main capital of Orkney, is on the Orkney mainland, and that has a population of around 5,000 there. But there are, in total, there's 20 inhabited islands of varying size of population. From under 100 up to maybe 400 or 500. I think Sandy are maybe around 400 now. So that's the island I'm on today. I think, round about that kind of number. And obviously it's a remote and rural location. I think that was one of the reasons that we're looking at the links with your local area as well, that's also a rural location. Say one of the kind of particular aspects of Orkney is having these islands they're referred to as ferry link tiles here. So there's ferry and internal flights that go to those islands. So I'm mainly going to speak about the Komp one-button computer, which is one of the devices that we have bought as part of the project, the Tech Peer Mentor project. So within the Tech Peer Mentor project, one of the things that I've set up is a tech library. So that's a range of devices that are available to use for demonstration purposes. So I go to Kirkwall Library once a week, one morning a week, with various devices like Alexa, speakers, smart bulbs, smart plugs, those kind of things that can be used, that are consumer tech but can be used for health and well-being. So I have those to display, but also people can borrow devices for up to 3 weeks. And one of the first device we had as part of that, actually, and which I never have at the tech library, we only have one, and it's always out on trial, is the Komp one-button computer. So I heard about this from another area from Western Isles, actually had some of them that they were using as part of a kind of similar project to mine. So it looks a bit like an old-fashioned TV. I'll just go back to that previous slide. As you can see, the one button is it's that knob on the bottom right, and like an old television, you turn that to switch it on, and as you turn it up, that's the volume control, and that's the only controls that you have on the Komp. Is the on and volume. Everything else is operated, so it's a receiving device. You can't send anything out from it, and it was developed and designed alongside older people. So it's a Norwegian company, No Isolation, who developed the Komp, and they were asked to produce a device that would tackle social isolation for older people. So they very much took into account a lot of factors, a lot of what the people they worked with, the older people they worked with, said were the most important features for them, and really taking away the things that they found difficult. So some of the kind of example of a few of those things are there's no touch screen. So I've identified that older people in particular, just because of the nature of changes in their skin, they find it, it can be more difficult to use touch screen. There's no updates to deal with, so there's very little change to how the Komp looks and its functions, and that's a deliberate decision. So if there are any software updates or anything, they just happen in the background. You're not required to go in and do updates or anything like that on device. It just automatically happens. Is pushed out from the company to the device if that's needed. So it looks the same. It's auto answer. So there's really three functions that the Komp can do. It can receive photographs, you can send messages to it, and you can video call it. And it's got quite a wide video camera on it, so it can be positioned around the room, wherever kind of suits the person best, as long as it's pointing towards them and it's positioned in a place that they can see easily. The camera tends to pick up the person wherever they are. It goes really quite loud, so if there's hearing loss difficulties, I say it's got a good high volume for that. It's got a high contrast screen, so it's it's easy to read the messages, easy to see photographs. So a lot of those things have been taken into account. So that's how it appears from the user side. And what happens is it's the design of it is about keeping people more connected with their families, so staying up to date with with what their family are doing. So and that being a network. So if if a daughter is out on a walk, the idea is they would just send a photo of where they are. This is us on the beach, and you can put a little bit of text on the photo as well. And it goes and it stays on the Komp for 2 days as default, and then it's deleted. You can change so that it's up there for less time or more time. But as I say, the idea is that different family members or friends are constantly providing new photographs or messages. So it's more like being connected in with that network, rather than maybe the idea of a digital photo frame or something where you would put on photos and they would just be the same ones that are always going round. So yeah, as I say, that connects people with family and what's happening up to date. And each photograph or message stays on the screen for 20 seconds as a default, and then scrolls to the next photo or message, and it just scrolls around the different photographs and messages. It also scrolls to the time and date, and it also has weather, shows you the weather and things as well, and if you want. So so those are the main functions. From a family's point of view, there's a very simple app that allows them to communicate with the Komp. So the app, say, just has those functions of sending photos, and you can add a bit of text to them, the messages, and then video calling, which is when you video call to the device, you excuse me, you press video call, and the person who has the Komp will see a countdown from 10 to 1, and the photograph of the person who's video calling them on the Komp will appear. And then once it gets to 0, the video call just starts. So it's an auto answer. You don't need to do anything. So particularly, there's kind of two aspects to the Komp, really. There's the Komp for families, which is what I've described there, and say with a real aim of creating closer connections with family and improving those networks with family, keeping people up to date with what's happening there and then. And particularly, it's really so it's particularly useful and designed for older people, so people who maybe don't have digital skills, don't manage with other kind of devices like iPads or smartphones, that find they're just too difficult to operate. And some of the issues with those kind of devices is that they constantly change, and maybe a button to FaceTime is in one place and then it gets updated and it appears somewhere else and it looks different. All those kind of issues are sometimes barriers for people. The other particular use found for it is for people with no mobility as well. So where it's probably my experience within Orkney of where it's been particularly successful is where someone tends to be in maybe the same seat that they have through the day. That might be an older person who's there most of the time, or it might be someone lacking mobility, and you don't, because it auto answers, they can just receive video calls. The other part to it is the Komp Pro. So that is for care providers, and the Komp Pro, it's a sort of separate stream to the Komp for families. So the person who had the Komp, they would just have the Komp there in their home, and their family would have the app that I've described and can send them photos and messages. One of the important things, actually, and it's probably something I didn't really appreciate how important it was initially, was that everyone who is in their network, they each get a password to join the network. They see what the other family members, which photographs they're sending, and they can see the messages, although with the messages you can make them private so that other people that are part of the network can't see messages if you don't want them to see that. But part of the idea of that is that if your granny has the Komp, and her grandson sent a photograph of him at a music festival, then other family members know that they've received that. And one of the benefits that we have, come across here or people find here is just when you're then speaking to Gran, people know what kind of things have been shared and know that they've seen that the grandson's been at a music festival, and it gives actually more to talk about. It you know, that was what was described to one person who had it on trial and then they bought it, was that they've noticed difference that now when they maybe phone up or they video call in to talk to the person, they've got more to talk about. Because the person knows more about what's going on in the family, and they can share that. So the Komp Pro, that all that side is still there. With the Komp Pro, the care provider has a separate stream, so they don't see the family photos or messages or anything, and the family don't see what the care provider is sending to the Komp, so they can send messages about, say, an appointment for, a health appointment's due, or a particular carer is going to be visiting that day, and maybe their photograph. They can send calendars to it of what's on that week or on that day, and they can also send reminders. So perhaps that's for a medication reminder or something that can be set for certain times, and then that would come through with a message and say a reminder, remember medication in half an hour, or so it's more, I say, to support the work of the care provider that goes through that stream, and we've got there's been a number of people who have trialled the Komp now in Orkney, and our Orkney Health and Care Partnership are also running a trial with the Komp Pro that's just started as well. So I'm going to be really interested to see how they find that side of it. But certainly initially they've been using it just for family, and they've had really positive feedback from that side of it. So it'll be interesting to see how they find the Komp Pro. I think I've probably gone through the sort of benefits and limitations there. Say the kind of really it's been really quite successful for the majority of people who've tried it, and people have been much more accepting of it than I thought they would be, because particularly it's got particular use for people with dementia, or say older people who maybe are housebound, and I wondered if they would be much more resistant. And what I find is initially when it comes in, some have been, but mostly they've actually quite quickly become used to it and actually enjoyed what they've got from it. I would say probably one of the main limitations is I've just forgotten what the main limitation I was going to say was there. I've remembered. Is if someone is not there, is around different houses and room, maybe not there a lot of the time, they can miss video calls in. And one person that we had that it didn't really work for, they were some of the time, and it was set up in the living room for them. There were some of the time in the living room. Sometimes they were in the kitchen. Quite often they were out the back, and family would try and video call in, and they wouldn't get an answer. And so it didn't really work. And she also switched it off a lot. So didn't really kind of understand. Although family said, "Look, just leave it on. You don't need to switch off," and that's what we generally recommend: is just have it there and have it on. Or maybe switch it off overnight. But she was quite often just going and switching it off. So if someone's going to do that, and if they're not liking it and they just want to have it off, it's not going to work well for them. So yeah, I've got a few quotes and things from the feedback in Orkney. As I say, I think I've had it trialled with 6 or 7 people it's gone out to, say, for 3-week trials at a time. One person had it for a couple couple of trials of 2 weeks each. Really positive feedback in general, and actually of those 6 or 7 people, 3 have bought them. So I was actually just out this morning helping someone set it up. Probably one of the benefits, it's actually really simple to set up and use as well, so they probably wouldn't have needed any support with that. But yeah, really, so I think I'm quite amazed actually that number of people have bought it, and I've also had an email from the first person who trialed it saying they're thinking actually they may well go ahead and get one after all. So so people are really seeing the benefits, and seeing that quite quickly if it suits them. There's just a couple of quotes then from feedback we've had. So the Komp was great for Granny. She didn't have to do anything to connect; it did it all for her. So this was someone who had it just in their living room, was really quite skeptical when I arrived with it. And one of the really important things, I think, is having a family member who's really encouraging and really keen just to give something a go and encourage the person just to give it a go. And I thought it wouldn't last long, I have to admit, when I took it. She was, very skeptical about it. So I was really surprised when I went back to collect it a few weeks later, and they said, "Yeah, I think we're going to buy one." And when I was in collecting it, Granny was saying, "Yeah, I want one." So they did buy one. Second one there, it helped Mum keep in touch with granddaughters who were studying south. It was a great help for me able to check in from a distance. So again, it's have given that ability to have video calls with family members anywhere, in the world, and it being so simple. So kind of at least a couple of people who have had it on trial have tried using iPads or something similar, but it just not really working. Just technically, it's been a bit too much, but have found this has meant that they've been able to stay in touch with family, anywhere. So, and just one more quote. I've taken up a good bit more time than I meant to, but just this quote that my parents really love it and decided to buy one after having it for a couple of days. The dad. He was really worried about what they'd do if it hadn't arrived by the time the trial ended. So again, his family, both parents with dementia, the mum in particular, had quite significant dementia, and had tried with an iPad to be in touch with family, and it really hadn't worked. But as soon as they'd had it for a couple of days, it was really kind of transformative for them as a family. So that, I think, is everything. Just some of my contact details there as well, and please do just get in touch if there's anything you'd like to have a chat about or find out more about, and I hope the rest of your AGM goes well. Thank you.
I found that very interesting in terms of having something very simple that could be used by particularly older people, I guess, but anyone who has difficulties with technology. The idea of a one-button computer, my mum would be in heaven. She just hates the buttons on things these days. So yeah, that was really good. So now we have Jonathan and Mia from Pembrokeshire. Are you both speaking, or one of you speaking, and what are you planning to do?
John's doing all the talking and I'm supporting him.
Which is not always the case, Mia.
Fire away, John.
How does that look?
Brilliant.
Brilliant. Oh, that's a relief. Right. So yeah, good morning, everyone. And thank you for having us, really. Got to get that in straight away. It's great to share the work that we've been doing in Pembrokeshire, because even though we are a little bit biased, it has been really successful. So the project it's called the Connect IT project, which is run by the community connectors in Pembrokeshire, and the team, which you can see on the screen there, it's a fairly small team, but it's expanding, as Mia will probably touch on now. There's 3 members of staff, new members of staff, going to be appointed next week. Do you want to mention that now, Mia?
Yeah, so actually today is sifting day. So Gwyneth and the team in Haverfordwest are going through, we've had, I think, over 30 applications for 3 positions, which is really exciting. Yeah, well, those people, those new connectors will start then in January after Christmas.
So the team's expanding, which is, only bodes well for the project to expand, really. So there's a map of Pembrokeshire, and currently you can see where the team cover. So, it's very rural, like yourselves, really, where the team have a large geographical area to cover. So obviously new members of staff and additional members of the team is going to hopefully reduce and increase the connection they have within the community. So with regards to where the Connect IT project sits in, obviously we're all familiar with the pre-COVID of arranging and meeting face to face, and wherever we could introduce any form of digital technologies in various meetings, we would do it, but it wasn't necessarily a priority. And then obviously it fast became a priority. We were fortunate that Powys were proactive in the sense that they knew that there needed to be this shift in order to ensure that people weren't left behind with regards to isolation and communication and contact with friends, family, and loved ones. So I initially had a conversation with Gwyneth, I think it would have been June, May, possibly 2020, where we identified that we need to introduce a digital scheme that is going to be able to allow members of the community to stay connected. So I came on board as a freelance IT digital support guy, the geeky stuff, in order to see, right, what can we do and how can we make it work. Gwyneth went away with the team at Powys and sourced the funding, and I'm sure if anyone wants any further information regarding that, then we'll pop. Gwyneth won't mind me putting her as the lead, putting her email in the chat for you to contact her, because obviously, like everything, digital funding is key, really. So we were fortunate enough that funding was there. So everything went online, and we came to the conclusion that a lack of 2 things, really: devices and an internet connection was the problem in Pembrokeshire, and I'm sure we'd agree it's not just Pembrokeshire. There's a lack of devices in general, and then that goes hand in hand with any support and training that people may need. So we put together a package called the Connect IT project, where it was initially a 2-month loan of a tablet with some support and signposting to any additional support that members of the community could access. With regards to eligibility, it was pretty straightforward. It was as long as the individual was registered with a surgery within the county, they were eligible for the loan. And it was great that we have covered a range of demographics and individuals, from children who were in school and didn't have access to digital devices for the home schooling during lockdowns, right up to then the elderly who had friends, family outside of the county that they wanted to stay in touch with, and then also those who haven't got anyone and just wanted that interaction with regards to what the internet can provide, whether it be news or general radio, TV, or online video. So we covered everything from the primary school children right up to the elderly who wanted some sort of interaction within the community. So we soon just realised that we had the project and everyone was excited with the project, but we needed to get the project out there. And logically, from the IT guy thinks, well, let's push it out on social media. But ultimately, the people that we needed to reach, well, they weren't on social media. They weren't leaving their homes. So how could we get the information to them? And I'll be honest, that's probably been the biggest stumbling block. And one that we've really fought to push. And there's a list there of a few of the organisations and sectors that we've used in order to try and push it out. Because ultimately, if people aren't aware of such a fantastic project, then they weren't going to benefit from it. So we did go down the social media route on the hope that the friends and families would see it and then pass it on. But also we used the emergency services and then the council and various agencies in between to get that out there. So as far as I mentioned that geeky side, just to give you an idea of the tech that we went with. The tablets are a Lenovo M10, which we got directly from Lenovo themselves. We went for the LTE version, which is the version that takes a SIM card, because I mentioned the access to the technology is a problem, but also access to the internet is a problem, because ultimately if someone's got broadband in the house, then they'd probably have a device, or they would have a device that connects to it. So we were working with people who had neither. So to tick that off, we did initially look at the Wi-Fi boxes. So Huawei are probably the most popular, no bigger than a credit card, where you put a SIM card in. But then we felt that, well, that's another device to charge. It's another device to turn on, turn off. So we went with the tablets that took the SIM card in the side. And we went with 3. We found 3 to be the best network based on what they were providing and also the coverage. They provided a 24 gigabyte SIM card with no expiry date. They were at the time the only provider with no expiry date. Vodafone was 2 months. EE were pushing you down for a contract, which isn't something you can really do on a mass scale for something like this. Every tablet came with a case. A few months in, we had some queries regarding some LD users wanting to check that they were robust. So we went for a few shock-proof, and they're like the thick foam with the handle cases. So the devices were protected. And then software, they all had a Google account, which we set up. We put together a profile, which we duplicated across the tablets. And then the key then is the Manage Engine software, which allows us to fully control the devices remotely. So if someone has got a problem and the tablet is on and connected to the internet, we're able to manage it and just take a little look at what any problems are. The most popular and common problems would be they'd move apps around and maybe be unable to locate them. So it was a case of just moving apps back to where they were, or to highlight where they can access them. The Manage Engine software gives us access to a map, and we can see exactly where those devices are, which again gives us an overview as to where the popular areas have been. So you've got Pembroke Dock at the bottom there, which is highly populated, and then Haverfordwest in the middle, and then Milford then just a little bit to the left of Pembroke Dock, which is here. So apps, we did a bit of brainstorming early doors as to what apps would people want access to. A lot of these were built in, so Google Chrome, Gmail, YouTube. The camera and the photos apps would provide people with something different, really. The majority of users would never have taken a digital photo, so that was another aspect that we were able to provide. Obviously, Zoom was on there. BBC iPlayer, Duolingo for learning another language, BorrowBox is the library app for connecting to local libraries. So they've all proved really successful. There's a healthcare element, so the NHS app, the NHS Attend Anywhere, which is the video conferencing app for any appointments, and then My Health Online, which is the general NHS Wales. It isn't actually an app; it's the link to the website. We made sure that that was on there as well. So just to give you an idea of what people are doing, I mentioned Zoom earlier. Possibly 4 months into it, it was an oversight, if I'm honest. I didn't realise that WhatsApp.
Sorry, Jonathan, I just need to remind you, we need to finish in the next minute, if that's okay.
Brilliant. WhatsApp, all right. WhatsApp has been really popular, okay, because there's a SIM card, it's got a number, so therefore you can connect, video call, send images, and so on. I'll whiz through here. We've got over 150 tablets out. We've added some Alexas, which have proved quite popular, and ultimately it's working really well, and it's continuing to grow as a project with multiple tablets going out on a weekly basis, basically. So yeah, that's PABS and the Connect IT project. I told you I'd waffle here, but ultimately, if you've got any questions and you want to contact us at a future date, then please do so. I'm personally surprised that it isn't been pushed. It's obviously funding, I get that, but it's something quite unique to Pembrokeshire.
Jonathan, thank you very much, and I'm really sorry to have to sort of cut you short.
Not at all.
Like most enthusiastic people, you want other people to know everything about your project, and that's great. But it's good that you'll be able to share the presentation, that we will be able to share your presentation with people, and that they can get in touch with you. So I expect you've probably put your details in the chat already, but if you haven't, could you do that?
Yeah, great. Thanks, everyone.
But it's a great project. Thank you very much for coming and for sharing. And Mia too, thank you. And Peter's obviously come back. Sorry that you were cut short, Peter. Our Head of Health and Wellbeing, Claire Swales, is going to tell us a little bit about the Welsh Government funding. And while she does that, I might just turn off my my screen so that I can help Ali perhaps with the breakout rooms. Thank you, Claire.
Great, thanks, Sue, and good morning, everybody. It's lovely to see so many people on this session. I think if we've been taught one thing over COVID, is that loneliness and isolation is a real issue for people across our communities and for people of all ages. Many of you will know that Welsh Government have been looking at loneliness and isolation for some time now, and they have actually produced a strategy for tackling loneliness and isolation, and I'll put a link to that strategy in the chat pane in a short while. But earlier this year, they announced that they were going to provide some funding for loneliness and isolation, or to tackle loneliness and isolation. And I was very lucky to be able to be part of a small working group with Welsh Government looking at that funding and what that might look like. Unbelievably, and I know lots of people in the sector will agree with this, it's funding for 3 years. When do we ever get funding for 3 years? I know, I can see Amanda's shocked face there. It's normally year on year, or money to be spent by the end of March or something like that. So really pleased that that is happening, and really pushed hard as part of that working group that the money is available to the third sector as simply as possible. We don't want long application processes and what have you. Having said that, we are in the process of finding out how much money is actually going to come to Powys. What they did do was actually allocate a certain amount of funding per local authority area. And I guess we're quite lucky here in Powys, where we have that co-terminosity. So we have one health board, one local authority, one CVC. And the funding has been channeled through the local authority, but in partnership with the CVC. So just first of all, a bit of background around the funding. As I've said, anybody can experience loneliness and isolation. It can be any age, any background. And we understand the impact that loneliness and isolation can have on people's physical and mental well-being, and the importance of relationships that we have with family, friends, colleagues and neighbours in giving our sense of belonging and well-being. So the isolation and loneliness strategy was launched, and it set out Welsh Government's vision of a Wales where everybody has the opportunity to develop meaningful social relationships, and where people are supported at those times in their lives when they are most vulnerable to loneliness and isolation. The strategy has committed Welsh Government to establish the 3-year Loneliness and Isolation Fund to help support this vision. And that was making available £500,000 in each of the 3 years. That's across the whole of Wales. It works out roughly by local authority area of 22,700 and something. Somebody probably far better than me can do the maths much quicker, but that's what it works out roughly. So we know that groups within communities will have different needs and will require different levels of support, but we also know that small amounts of money can make a big difference to small-scale, community-based activity, providing locally tailored responses, unlocking previously untapped or underutilised potential. And the investment can be used to help small organisations to scale up existing activities, to re-establish themselves after the pandemic, promote themselves more widely, and help find the use of suitable venues. Whilst, of course, we might want the fund to support activities which bring people together face to face in a safe and secure way, we know that's not suitable for everybody. So the funding can also be used for online activity, and we've heard some great examples from Jonathan this morning. So what is happening currently is that the request for funding for Powys has gone to Welsh Government. We had an email yesterday just clarifying some further details, and we should know at the beginning of December about the allocation for Powys. This will then be distributed. I say distributed, you'll be able to apply for it through a quite simple grant scheme that PAVO and the council have agreed on. And we'll make sure that everybody has access to that grant application process. And what happens is that there will be a cross-sector panel making the decisions on those applications. So it's not down to PAVO staff to make those application decisions. It will be a cross-sector panel. The council will be the grant holder, but as I said, it will come through that function through PAVO. As you know, we distribute many grants for many organisations. So we have that experience. And ultimately, it's to be used for community groups and voluntary organisations that support people that are or at risk of being lonely and socially isolated. During the 3 years of the project, partners will determine the specific priority areas, because we know priorities change as we go along, and this will be reviewed on an annual basis. And we will collect the data and information to inform the wider partnership about the work that the community sector is doing around loneliness and isolation, and feed into that bigger picture around the needs of the Powys population. So, as I said, this will be a multi-agency panel that will make the decision around the funding, and we hope that that will happen really quickly, so we can make most use of the funding. The first year's funding will need to be, of course, spent by the end of March, and then we'll have year 2 and year 3. Monitoring and evaluation, we like to keep this as simple as possible. We don't want it too onerous, and it needs to be proportionate. So if a group is applying for a small amount of funding, we don't want you to spend 50% of your time actually monitoring what you're doing rather than actually delivering. So that's really important to us as well. And what else is there? Yeah, and I said about sharing the learning to the other strategic partnership boards and through our networks as well. So we gather that learning from that. So it's a heads up, really. I know lots of you have probably already got ideas in your minds about how you might like to use this funding to help tackle loneliness and isolation in your communities. You might be going away now thinking, oh, I've got some ideas we could explore with other colleagues and other partners. So definitely keep or get your thinking caps on. And we should know early in December about the funding and that process. And we will make sure that's available through all of our networks, on our website, on our social media, so it's advertised really well. So Sue, I think that's it, unless there's any questions. As I say, we're just waiting for the final go-ahead from Welsh Government, and hopefully that'll be very soon.
Thank you, Claire. Does anybody have any questions for Claire? Just unmute and chip in if you do.
I've just put the link to the strategy as well in the chat pane if anybody wanted to look at that. I'm sorry I'm not able to share definites about the funding at the moment, but that's as much as I can tell you at the minute.
Thank you very much, Claire. That's really useful. Well, it's 11:25 now. There isn't really time to give an extensive feedback from the rooms, but what we will do is we will sort of amalgamate the ideas from the 4 jam boards and put them out to you in a note form so that you can see what was suggested and said in the breakout rooms, because obviously working together is going to be a key thing. One of the things that I was talking about in our breakout room was the circles of support. We had a very, very interesting talk by a speaker earlier in the week as part of this PAVO conference, which was about circles of support as a way of supporting people who are lonely and isolated or had, particular needs, really, in terms of moving their lives forward. And that was really interesting. And that talk is going to be on the PAVO YouTube channel. So if you haven't explored the PAVO YouTube channel before, that the talks and also recordings from this session will be on YouTube as well. Just the expert sessions. I'd like to thank the people who presented. So that's Jonathan and Mia from Pembrokeshire and Peter McAndrew from Orkney. And again, to say that his presentation will be available so you can hear in a bit more clarity, hopefully, what he had to say. Thanks to Claire Swales, who talked about the funding that's becoming available. And thank you to my facilitators, Claire, McNiff, Shonard, David, and of course, tech support people. Where would we be without them? Thank you to Ali and to David as well. Thanks to you all for attending, and look forward to seeing you at other events this week. Bye then. Bye.
Thanks, Sue. Bye. 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 Bye.
Thank you.
Bye, everyone.
Bye.